Good day everyone, I am Marisol Santos, and for today's video, I am here to demonstrate the assessment of the peripheral pulse. The first thing that we will have to do is to assess the patient. You have to consider the clinical signs of cardiovascular alterations, other than pulse rate, rhythm, or volume, and also the factor that may alter the pulse rate. And also, we need to cite the most appropriate for the assessment, which is the pulse point. Then let's proceed with the assembling of the equipment and supply. We just need the watch with the second hand indicator. Also, if you're using Doppler ultrasound or DUS, we need to obtain the transducer probe, the stethoscope headset, the transmission gel, and tissues or wipes. Then you will have to introduce your name, speak with the client of what you're going to do, why it is necessary, and how the clients can cooperate. So hi ma'am, I am Marisol Santos. I am your student nurse for today, and I am here to perform the assessment of your peripheral pulse. I'll just check if there's any problem. So if there is, we can prevent it as much as possible. I'll have few questions, and you just need to answer it honestly. Is that a great deal, ma'am?
Yes.
So to verify the client's identity, you will have to ask the name and age of the patient. What's your name po, ma'am?
Rosalinda Santos.
And your age po, please?
74 years old.
Thank you so much. Next, we always need to do a hand hygiene before any procedures. It's up to you if you want to wash your hands or put an alcohol as long as it is 70%, and also before any procedure to avoid the contamination. So to provide the client's privacy, you can close the curtain, or if the patient is changing a gown, you can ask the patient if they want you to stay, they want you to help them, or they want you to leave. So if you have a client with the opposite sex as yours, you can ask someone with the same opposite as your client to stay inside the room while you're doing the assessment, so the client would feel comfortable. So next, let's select the pulse point. We have 9 pulse points, which is the temporal, this is the brachial, the radial, the apical here, the popliteal, sa femoral sa singit, pedal sa paa, then the posterior tibial artery sa gilid ng paa. So the pulse point that I chose is the brachial. Next, we have to assist the patient to a comfortable position. So you can see, sitting position, and her legs and her feet is flat. Comfortable ka po ba, ma'am? Next, let's palpate and count the pulse. You can place 2 or 3 fingertips here, as long as the brachial. So we have to count for 15 seconds and multiply by 4. Then we have to record the pulse in beats per minute in your worksheet. If the pulse is irregular, you can count for the full minute. And irregular pulse also require taking the apical pulse. So let's count for 15 seconds. Let's just use the clock above me, if you can see it. But I have my clock here. Okay? So that you can see what I am doing. If you can see the clock. So it's 20. Then we need to assess the pulse rhythm and volume. Then let's document the client's finding on the client's data. That's all. Thank you so much for watching.